Well, good afternoon, Victoria. Today is Gen-Tech's Decision Day. If you weren't aware, today Victoria College, UHV, and community residents wear the shirt of their alma mater to celebrate our graduating class of 2020 and their decision to pursue higher education or vocational training. In wearing apparel of the higher education we ourselves pursued, our hope is to encourage graduating seniors to make their decision today to also pursue that same education. We applaud them as they make their decision to become leaders in their next generation. For more information, students can visit their high school counselors, or an advisor from their college of choice. Regarding Governor Abbott's reopen Texas orders, those are in effect today. This means that some businesses, but not all, can begin reopening under the governor's phased-in guidelines at 25% capacity. If the next 2 weeks of data show that the virus is contained, Governor Abbott said that phase 2 could begin as early as May 18th. In phase 2, more types of businesses would be allowed to reopen, including the maximum capacity increased to 50%. For Governor Abbott's Texans Helping Texans full report, you can visit gov.texas, spelled out, .gov. We'll continue to do our best to help direct you to where to find that information. You can also call our hotline with any questions. One way we have educated our community about Governor Abbott's orders to reopen Texas is through our Fire Marshal's office. The City Fire Marshal's office has begun educating today local businesses about the 25% capacity rule under the governor's order. If you have any questions, you can contact their office at 361-485-3460. One thing I want to let you all know ahead of time is that starting next week, we will begin hosting press briefings Tuesdays and Thursdays, same time at 3 p.m., to relieve our local leaders, public health officials, and epidemiology team. We will continue, however, providing daily COVID-19 updates and information, breaking news, and anything else related to COVID-19 as needed. Now, as of 2:30 p.m. today, we have the following. One new case was reported. That brings us to a total case count in Victoria County at 140. Suspected community transmission is 34. Recovered is at 82, and active is at 53. This morning, we did receive a report of a COVID-19 related death of a female in her 60s. Our deepest condolences and our prayers go out to that individual's family members during this time. Out of respect for that individual's family members, we will not be releasing additional information. Today, we will hear from our Public Health Authority, Dr. John McNeill, about the importance of continuing social distancing and other CDC-related recommendations. We'll also hear from our Victoria County Public Health Director, David Gonzales, and he'll address continued processes we can expect to continue to see as we reopen Texas. At this time, I will now turn it over to Dr. John McNeill.
Thank you, Ashley, and good afternoon, Victoria. As of today, as Ashley just reminded us, we had one new case, and that's good news. The bad news is that we did have another case or COVID-related fatality, a female in her 60s that was hospitalized. It goes without saying, and as Ashley said, that we extend our deepest condolences to the family and friends of this individual that succumbed to this disease. Our total cases in Victoria are up to 140. And that number continues to rise. Our goal right now is, if it is rising, to keep letting it rise slowly. We're not sure what our peak's going to be because it keeps going up slowly. We're hoping that in like a lot of other places, that if this is our peak, that it goes back down quickly. I can tell you, and I can report that based on data from other places that are further along in this process than we are, that the peak seems to be sustained for a little bit longer than we thought. We hoped that it would go straight up and go straight down, but it doesn't seem to be doing that. And that just goes along with everything else we've said about this disease. This disease pretty much is making its own rules and setting the standard for what we're going to look for in the future. We've never seen anything quite like this, and I don't have to tell you all that. Our suspected community transmission is 34. We have 82 patients that have recovered, and that's always wonderful news. That leaves us with 53 active cases, 12 of which are in the hospital. Now, as mentioned earlier, we received the report about the COVID-19 reported death, and I've already talked about that. I want to talk to you a little bit about the severity of this disease, and I talk about this today because today's a big day in Texas. As y'all know, we're trying to open Texas a little bit, and I understand that. We're trying to open up Texas slowly, and a lot of places are only going to be allowed 25% occupancy. I would hope that everybody abides by those rules, and I would hope that everybody watches for those things. This will be one of the few times today that I tell you that wearing masks is a good thing. So, and I hope that everybody will continue to wear masks, to think about themselves and think about others as well. We're worried about the fact that, this disease is still increasing. So we're still seeing higher numbers. In fact, 2 or 3 days ago, I think it was on the 26th of April, we reported 47,000 or almost 48,000 new cases in the United States in one day. So that doesn't typically sound like a disease that's going away. And that pretty much goes along with a lot of the data that we're having. One of the things that I do want to mention to you today is that this talk about a second wave, and I know you've seen that in the news, and I watched Dr. Fauci talk about it last night and this morning. And one of the things that we're concerned about is that this second wave will probably occur. They think it'll be in August or September. That will correlate typically with the time that we start to worry about influenza. And our fear, one of our big fears, is that this will coincide with an influenza outbreak as well. That just means further strain on our health care, and it makes it harder because we're going to have more patients presenting with fever, chills, and viral type syndromes, and we're not going to know if it's COVID or if it's influenza or if it's another one of the many other myriad of viruses that are out there. So that just means that we have to continue to be vigilant. We have to be very careful, and especially now that we're opening up. We don't know what's going to happen. I would never say that this is a clinical trial or an experiment, but in a way, we're going to have to get our feet wet a little bit to see how this is going to work out. So we'll see. Hopefully the case load will not increase too much, and most importantly, hopefully hospitalizations and deaths will not occur or not increase as well. So there's been a lot of talk about this, and I want y'all to understand that when it comes down to COVID, there are so many new things. We're talking now about this virus mutating. We're talking about the work that they're doing on vaccines. We're talking about all the different medications. There was a new antiviral drug, or not a new drug, but another drug that was tested and showed potential help for patients. So we're looking for drugs that will treat this. We're looking for vaccines. And all the time, all the while we're doing this, we're working on social distancing and seeing what we can do to prevent the spread of this disease. There are a lot of different discoveries being made. I've had questions asked about reinfection, and simply stated, the data that I've seen shows that we really don't know if we can become reinfected with this disease because we don't understand the immunity that's confirmed with this disease. So when a person gets a disease, if the disease or the virus follows typical viral patterns, then we will develop antibodies for it, but we still don't have any idea how those antibodies are going to work for warding off the disease. We've talked about mutations. Initially, they said this virus did not mutate. Latest data shows that it mutates, but that information really says that it only mutates mildly. And if it only mutates a little bit, if these RNA strands only change a little bit, then hopefully the vaccine, when they get it, and they will still be effective. We've seen that in the SARS-CoV virus too, that one that caused the severe respiratory symptoms in the past. And we saw that virus also mutated, and COVID is very similar. So we're expecting it to do the same thing. Well, it mutated, but it mutated only enough to where a vaccine would still work. So that's our hope. But once again, we don't know. So we're going to keep doing the best thing. What we do know is that social distancing works, wearing masks work, and so we're going to keep doing that. Now, once again, let's talk about this disease as far as being contagious and being lethal. Remember that this disease is more contagious than influenza. It's a lot more contagious than a lot of diseases we've ever dealt with, and it can be lethal. Now, it may not be lethal typically in younger people, but I'm telling you, we have a lot of younger people that have been hospitalized in Victoria, and we have younger people that have had the disease and have become quite sick. I've seen a lot of them myself, and they are quite sick. So don't think that just because you're young that you can't get this disease, because you can get it. And most importantly, you may take it with you and you may spread it to someone that is elderly or someone that has more risk factors, multiple comorbidities like diabetes, hypertension, cardiovascular disease that will do worse with the disease. So that's another reason to guess what? do practice social distancing and also wear a mask. So they have a new term now. I was informed about this one, Prosper Respiratory Etiquette. I think that means that you cover your mouth when you cough and squeeze, or sneeze, sorry. That's not something that we've ever really been told to do. I mean, not on a regular basis or not with the consequences that it has as today. Once again, wearing facial coverings is always a good idea. Please remember that. The last thing I want to say is that we have received some complaints from establishments and patients not wearing facial coverings. Remember that we all need to play our part in reopening our economy. And this is going to be based on what we're able to do is going to be based on how this disease spreads and how many people get sick and how many people end up in the hospital. These are numbers that are being watched very closely. That's the data that we base our decisions on. So we'll continue to watch that data, and we'll continue to make recommendations. And the governor has made some good recommendations, and we're following them closely, and we'll continue to follow them. Remember that your facial coverings don't have to be an N95 mask. They don't even have to be a surgical mask like this. They can be any facial covering. The idea is just to prevent you from getting other people sick, and at the same time prevent yourself from getting it as well. So I'll be able to answer questions in a little bit, but right now, Ashley?
Sure. Thank you, Dr. McNeill. Well said. Just a reminder, cloth facial coverings are still recommended by the CDC, and it's a courtesy message that you're sending to others when you walk into a store and you wear it. You're being careful about yourself, but you're also protecting those around you. Dr. McNeill mentioned that there's potential for a second wave, right? And so things like this that we do now can help us to avoid exposure to others that could be more vulnerable than, say, yourself. A lot of them have underlying health conditions, like Dr. McNeill said. You don't necessarily know that. You can't necessarily see that. And so we need to do our job and play our part. At this time, we'll transition to David.
Thank you, Ashley. Just want to touch on a few things moving forward. First off, want to get into testing a little bit and where we're at locally and currently. Right now, as of today, we've done approximately 1,520 tests in Victoria County. We did about 260 over the past week, which is averaging about 35 tests a day, which is actually up since last week when we were averaging about 25 a day. So over the past week, we've done quite a few more daily and across the board than previous weeks. So that is good, shows the availability of tests in the community, and that we definitely have that capacity to perform those. One thing that we saw recently come out as of a few days ago was a testing site map that Texas Division of Emergency Management and Department of State Health Services put together. Statewide, it shows locations all over the state of where you can actually go and get tests. And that's going to coincide with the data and list that we put out last week that shows local testing locations. So we'll work on updating that map right now to include those locations so they're easy to locate. And those hopefully will be available sometime early next week by the time we get those that data entered, and it should be available on there. And then we'll push that out via our social media and outlets and our local websites. One thing that was discussed earlier in the week was the term contact tracing, and where the state and locals are kind of headed with that right now. So keep in mind, contact tracing is part of the epidemiological process of investigations. We've been doing that since day one. However, the state has really identified the growing need of that as we have more cases come on board, and the strain and the amount of manpower that it takes to perform those investigations efficiently. Right now, we are still doing locally. Our team's doing a great job of that. What we're looking, though, now is moving forward and transitioning this and understanding how long this is going to possibly last. There's a balance of continuing those investigations and also opening them up for us, other services within the city and county, especially with the health department. Currently, a lot of the staff is from the nursing division there in the health department. We're looking at, along with the rest of the city and the county, opening up to more services in the coming weeks. So we're planning accordingly to alter those processes, if you will, with those investigations. And one way to do that in backfill is going to be with those state resources that the governor discussed in the press conference earlier this week or last week. Those are still in the early planning phases, so we're getting more information daily. We're on a few conference calls yesterday with the state to understand what that's going to look like and what resources they're able to provide to us to really help us as locals out handle this in the long term moving forward, while able to also provide and perform the daily services we are used to doing in the health department right now. As Dr. McNeill touched on earlier, we did definitely had a high point on the 26th of this month across the nation as far as for new case counts. Luckily, after that day, we had a sharp drop-off down about 20,000, 26,000 actually less cases, but we've continued to climb back up slowly every day. So again, just stay vigilant in the protective measures and the social distancing. This is not going away. We obviously celebrate every day we have low case counts or no case counts, but there's no indication this disease does still not exist in our community. So we urge the public to protect yourself, protect others, maintain that social distancing, and then wear facial coverings at all times if possible. Moving forward, just as Dr. McNeill touched on, keep in mind, especially with the younger people out there, when you're out in the community, it's not just about you; it's about protecting everyone else and protecting those that are more vulnerable, and do your part to protect that population. Because even though we've seen in some cases, a lot of cases, folks younger, healthier don't even realize they have it, but that doesn't mean you're not a very efficient carrier of this disease. So we want to really, really, urge that population still to wear those facial coverings to make sure you're protecting everyone else. With that, that's really all I had for today. I'll pass it back to Ashley.
Sure, thank you, David. And once again, that vulnerable population doesn't necessarily always indicate age, 65 and up, right? It
Correct.
also be those underlying health conditions, once again, that not all of us are aware of or can necessarily see. At this time, we will open it up for questions for Dr. McNeill or David. Sure.
In the news yesterday, there was a case apparently in Goliad where the person had tested positive and then recovered and tested positive again. Is that information accurate?
That's the information that I had received. I mean, David, have you heard anything different?
No, being a case outside Victoria County, we don't have the details on it, but I'm not sure if Doc
Is
has
that
any.
a reinfection?
Well, it's hard to say. And I actually looked up reinfection rates earlier this afternoon because I thought someone would ask that, Ingra. But the truth is that we just don't know. And the only way we're really going to know that is when we have mass testing available, when we can test everyone else around. I would think that there's a possibility that it was reinfection, although that would kind of fly in the face of everything that we're talking about as far as immunology and the ability of vaccines to work and the IgM, IgG testing that we're talking about. So the other concern is that this was probably just a latent phase of the disease that just reappeared. I mean, I say reappeared, but it really never left. So there's always a possibility of a false negative test. This person could have been tested or assumed to be recovered. I don't have the data. But I can tell you that we have seen patients, and there's documented evidence of patients that shed the virus a lot longer than 2 weeks. So if I were to bet on that, I would bet that it was probably just a continued infection from the initial one. Of course, that's just a theory. Yes, please.
As you mentioned, Dr. McNeill, today's a big day for Texans with businesses reopening. I'm wondering, and this works for you too, David, what kind of advice you can give to, committee members who are considering going out to eat or going out to shop, kind of what things that they should be considering?
Well, that's pretty much the guidelines. If you look at the guidelines that the governor has put out, there are actually guidelines, and I think we looked at those at our last press conference, and we talked specifically about what individuals can do. And I mean, I hate to say wear a mask again or wear a facial covering, but that's a big thing. You can do that to make sure your hands are clean. Just do the normal hygiene practices and the things. Avoid sick people. Don't go out if you're sick yourself. Hopefully all establishments that you go to will help you with social distancing. I know that some restaurants have taken a smaller number of chairs and placed them in their dining room, and people are wearing masks. And so we're trying to do everything we can. We would all like to see this be successful because I can tell you that most restaurants would like to be able to go to 50% in 2 weeks. But that's not going to be a very good recommendation if our cases start really increasing. So we have to work together on this, and working together starts with taking care of yourself.
Absolutely, yeah. And if there's anything, I mean, just personal responsibility. And if you walk into an establishment, a store, and it's really, really crowded and you don't feel comfortable going in at that time, you know what, maybe go at a less crowded time, go a different time of day to really reduce the amount of exposure, and that way you can maintain that social distance within the stores and establishments as well.
I'm going to add to that as well. The Texans Helping Texans Governor Abbott's report is available online. He goes into detail, too, about those recommendations for individuals who do plan on visiting facilities beyond just a restaurant, right, that are going to start up reopening. Some of those include, again, maintaining the 6 feet distance. Self-screening, that's a big one. If you have any of the symptoms, which include those 6 that recently were added on by the CDC, cough, shortness of breath, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell. A couple others are listed here. Constantly wash or disinfect your hands upon entering a business, and some of them might even have signs or flyers indicating what they expect as a business owner and operating their business on their doors before entry. And so that's the advice that I think we would recommend and stick with in consistency with Governor Abbott.
Absolutely. Yes, ma'am.
I did not want to presume to know the answer to this, but this was a community question, and it's sort of directed to you, David,
Okay.
which is, originally you had posted and listed for us areas and maybe particular businesses where the public might need to consider postponing visiting once you had confirmed that a positive case had visited, an establishment until there was cleaning and investigation done. Outside of the fact that there are so many more numbers now, why are you guys not posting that?
Yeah, that's a good question. No, and what he was referring to are some of those establishments where we had those low-risk contacts that we had possibly exposed, or those cases exposed under other members there. There's 2 parts to that. One, from what I understand, there hadn't been any occurrences where there was some medium risk there to the community, where there was a need to do a mass notification. Another, as we move up in the transmission risk level in the community, going from none to mild and then mild to moderate, you pretty much assume that at this point, if under moderate transmission risk, most places you go, there's some sort of risk low risk, that there's other members in the community there. There's one press conference I refer back to a CDC document that addressed the communal spread within communal settings. So anytime you're at a store being in a moderate transmission level across the community, anytime you go out in public, there is a small risk, a mild risk that you could acquire the illness in those settings. Now, hopefully, with the what was once a requirement here locally, with the employees wearing masks, and obviously the strong recommendations that the public does as well, or facial coverings, we've reduced those risks if you are in mask or maintain that social distance. So that's one of the reasons we haven't issued any more at this point.
We've talked quite a bit about how community transmission and, of course, the number of cases factors into risk assessment for the community. But could you maybe tell us a little bit about how the number of deaths factors into risk assessment and kind of how you're looking at those?
Well, of course, that's just one of the many components we look at. I mean, if they both start going up. But remember that when we look at these numbers, you have to understand that some people don't die from this disease for a month. I mean, there are people that are critically ill that have been in the hospital for 3 weeks, 4 weeks at a time before they expire. There are patients that have been on mechanical ventilation for 2 and 3 weeks at a time, and they come off and either make it or they don't. So it's kind of hard to say what those numbers are, because in that case, you're looking back, and the epidemiology people are good at this. They look back and they say, well, this might have been community transmission, but it was 3 weeks ago. So not that a death is not pertinent, but as far as we do consider those, but we look at them in the respect that basically how long did it take and when did that occur? And community transmission was a different thing 3 weeks ago as to what it is now. So those are just all factors we put in there. We look at the number of cases, the new cases that gives us more immediate data, and then we do the contact tracing on them, and we find out where did they get it, or how did it go? Were they exposed to someone that was a known COVID patient, or were they a family member of a known COVID patient, or did they just go to HEB and then that's the only place they went and now they have COVID? So I'm not picking on HEB because they actually do a very good job, but for the most part, it's just a piece of the puzzle. But remember that the deaths do lag behind the current disease numbers.
My last question is, all things considered, what do you think that this second wave might look like? Do you think it has the potential to affect the United States or the world as the first wave did?
I've been very interested in that. I've really read a lot about it and looked at a lot of different things. And I'll tell you, A lot of people say that it's going to be devastating. A lot of people say they don't know. I haven't found too many that say it's not going to be a big deal. So when you look at it in that respect, one of the interesting things that I did read is that, we've talked about this whole concept of herd immunity, and we've talked about this concept of people being able to basically find enough people that have been exposed to this virus so that they develop immunity so that the virus does not have a good reservoir in our community. In other words, it doesn't have a good place to spread. So when we look at these numbers and we look at herd immunity, we realize that we're probably not going to hit herd immunity for this disease until it's in the 50 to 65% range of people having it. The scary part is that the second outbreaks that they're talking about and this resurgence of this disease, they expect to be in areas where there was not a lot of disease before. So they specifically say Middle America, because there was a preponderance of this disease, of course, on the East Coast, and with the exception of metropolitan areas, the West Coast was not as bad. But they're afraid that it's going to go into the most common area, and that would be the area where there's the biggest reservoir, and that would be the spaces where there has not been a lot of disease. I personally worry about areas like South Texas and Victoria specifically, where we've had disease, there's no doubt about it, but we don't have it rampantly like a lot of places have. I worry about a second wave affecting us worse than the first.
Now, I'm sorry, I wanted to ask you, tell me about herd immunity, the definition of herd immunity.
Well, the definition of herd immunity, it simply means in immunological terms that you have enough people that have already been affected that they have developed enough immunity to protect themselves. And basically, if everybody in this room had herd immunity and I had COVID, I'm not going to give it to anybody. So there's no spread. There's no.
It's not an acronym. You mean like as a gathering of people heard.
Well, as nicely as I can call the people in Victoria herd, yes.
Yes, okay, thank
that's
you.
exactly what we mean. They also call it community immunity, by the way.
Okay.
I think herd was easier to say. So, but for the most part, I mean, that has to do, I mean, that's directly correlated with how infectious this disease is. They take that R0 number and they know that for COVID-19, it's between 2 and 3. In other words, every person with it has a propensity to infect between 2 and 3 people. And that directly calculates the herd immunity requirements. So for this disease, it's between 50 and 63%. So we'll see. I mean, you don't want everybody to be infected, but by the same token, it would be nice if we had some herd immunity. And if it does recur, it only makes sense that it's probably not going to recur as aggressively in an area where a lot of people have already had it. So,
Time for maybe 2 more questions.
One more. With regard to peaks and kind of, other communities that have seen a longer peak than they expected in terms of sustainment, how are we preparing for, the possibility of that being the case here?
David from
Sure.
Columbia.
Yeah, I think that goes along to our local resources and our plans for sustained response, sustained investigations. Also leaning back on the healthcare system as a whole, not just with public health, but looking at their ability to handle continued patient care, which has done a great job thus far. And that goes into looking at continued opening up the economy to make sure they have the capacity there and can take on additional patient loads if this were to be sustained and spread moving forward. And this peak, in a sense, it's hard really to look locally and derive a peak in a sense, because it's a relatively small sample size when our major days are when we have 8 and 10 cases, which is severe for our community, and it's something we look at, and it does have an effect not only on public health resources but also acute health care. So for us, we're looking at that total picture, and even not just locally, that goes across the region as well. We're looking at those regional cases. We're looking at the regional healthcare capacity. We have a great group here that's in communication with each other constantly and sharing information. So we want to make sure those are resources available as we go through this.
Do we have any other questions? Okay, if not, I will thank you all for your time. Thank you, viewers, for tuning in. Thank you, Dr. McNeill and David, for being here, Karen as well. Once again, want to remind you that as of 2:30 p.m. today, we had 1 new case of COVID-19, giving us a cumulative case count of 140, which includes, again, Victoria County and the isolated p.m. outbreaks. We will update our website and social media pages with new case counts, should any come up, between 5 and 6 p.m. this evening, once ongoing investigations are completed for the day. The next press briefing, if you guys are just tuning in, will be Tuesday. We're no longer doing Monday, Wednesday, Friday. It's Tuesdays and Thursdays, same time, 3 p.m. And so we will see you then. Of course, daily information also will be shared to our Facebook pages and our website as well. If any other breaking news comes out, we'll of course share that with you as well. For more information about the governor's report that I alluded to a second ago, you can find that online at gov.texas.gov. We also have a copy on our website at victoriatxoem.org. Thank you once again for viewing today's briefing. Hope you have a great weekend, and we'll see you Tuesday at 3 p.m. Thanks.